New Brunswickers are now able to see a pharmacist for refills on prescriptions. Beginning October 30th, this change enables patients to renew prescriptions faster and easier without going to see their doctor. Ron Jackson, a pharmacist at Shoppers Drug Mart, says this is especially good for people suffering from chronic illness.
A patient's been on a blood pressure medication for a number of years, realizes that they don't have any refills left, and are unable to make an appointment to see their doctor, then we're certainly permitted to continue that therapy.
New Brunswick and Alberta are the only two provinces to allow pharmacists to perform this job. Amendments to New Brunswick's Pharmacy Act were made earlier this year. These changes should help reduce the workload of doctors in the province.
We have people going to the ERs, going to the emergency rooms after our clinics to get a refill on their blood pressure medication. And one might say, is that the best utilization of the ER or the walk-in clinics?
It will be at the discretion of your pharmacist to write a refill prescription. This isn't a replacement for regular doctor visits, and narcotic and tranquilizer prescriptions must still be given out by a doctor. Sabrina Soterio has lived in Fredericton for the past 3 years. She says this change worries her, but that she will probably take advantage of it.
I may be a bit reserved as to what kind of prescriptions I would go and ask pharmacists for.
Anna Galvin, a St. Thomas University student, says this change will be helpful to people who don't own cars.
I think it would also help with people that don't have their own transportation around town. Maybe it's not as easy for them to get to see their doctor, and we all know that getting in to see even your own family doctor is more and more difficult.
Jackson warns customers not to expect pharmacists to be a substitute doctor.
We wouldn't want our public to think that if they've got a cold, they're going to come in and automatically get an antibiotic prescription from their pharmacist.
The new service will cost more money. The exact price hasn't been determined yet, but it will be covered by your medical plan. For Stu Dispatches, I'm Melissa Oakley.